Hello, dear colleagues. Welcome back to our comprehensive medical aesthetics training series. In today's lecture, we will focus on one of the most practical and essential aspects of botulinum toxin application, injection techniques. Our goal, as always, is to deliver this content not just as theory, but as a real course experience enriched with clinical pearls you can directly use in practice. Introduction. Topical application of botulinum toxin is not effective. For the toxin to work, it must be injected into the correct anatomical layers. There are two main techniques, the standard technique and the microinjection technique. We will also briefly touch on other approaches and highlight what to avoid. The standard technique. The standard technique is the most widely used in clinical practice. Here, the toxin is injected in volumes of 0.05 milliliters or more using a 30 or 32 gauge needle. The injection is performed perpendicular or slightly beveled into the skin. This method is especially recommended for the corrugator muscles, where a precise and controlled effect is needed. A key rule: the periosteum must never be touched. The standard technique is best suited when the target muscles are well defined and the risk of adverse reactions is low. The microinjection technique. The microinjection technique is different in both purpose and execution. Here, very low doses of botulinum toxin are administered extremely superficially, almost intradermally. Each injection delivers less than 0.025 milliliters, spaced about 1 centimeter apart. This approach is particularly useful in delicate areas such as crow's feet, where diffusion to adjacent muscles like the zygomaticus major could cause unwanted side effects, such as an asymmetric smile. When performed correctly, small whitish papules appear at the injection points. These indicate proper intradermal placement and usually disappear quickly. For this technique, a 32 gauge needle is ideal, though a 30 gauge can also be used. Other techniques. Some practitioners attempt feathering or fanning injections. However, these should generally be avoided because they increase the risk of unintended diffusion into neighboring muscles, leading to complications or unsatisfactory outcomes. In botulinum toxin treatments, precision is far more important than coverage. Clinical insights. Here are some practical pearls from clinical experience. Use the standard technique for strong, well-defined muscles such as the corrugator. Reserve the microinjection technique for superficial fine lines and delicate periorbital regions. Always adapt the depth and volume to the patient's anatomy. And remember, it is not only about the toxin itself, but also about the finesse of your injection technique. Closing. Dear colleagues, in this lecture, we explored the injection techniques for botulinum toxin, the standard technique for precise muscular targeting, the microinjection technique for delicate superficial work, and the importance of avoiding poorly controlled approaches such as feathering. Mastering these methods will give you safer, more predictable, and more natural results for your patients. If you found this video valuable, please subscribe and give it a like. This helps us grow the channel and continue sharing high-quality, course-level knowledge with colleagues worldwide. In the next lecture, we will move deeper into specific facial areas and advanced strategies for botulinum toxin applications. See you in the next video.